afternoon and welcome. Thank you so much for tuning in to She Conversations. I'm Tanya, and this is,
Ashley.
and we're just excited to be here today. But before we get into introducing our guest, we always want to start off by thanking our supporters. Thank you, thank you, thank you to those that support our YouTube page as well as our social media. Um, we know that our organization would not be as successful or would not be allowed the opportunity to grow without your support. So we thank you for that. Did you have anything you wanted to say?
No, I think you said it all.
Okay. All right. Well, we have an interesting topic for you today. We're really excited about it. So I should say our topic is on maternal health. And it's an area that we've been wanting to kind of dive into for quite some time. We've wrote a few grants looking at infant mortality and about maternal health. And we've always been interested in like doulas and all of that. So we're really, really excited about this episode today. So, with that being said, we have Miss Kortny. I don't want to mispronounce your last name.
Feutardo.
Feutardo,
Yes.
that's here with us. And I guess just to say a little bit about you, because I'm excited that you accepted the invitation. I was speaking with a friend and I was having the same conversation with her about our interest in maternal health and all this. And I was like, do you know a doula? Because I'm unfamiliar. And she was like, I have the perfect person. She's professional. She's smart. She's engaging. She just ran to all these different qualities. And she said, I really think that you need to meet her. So,
Aw.
yeah, I'm excited that you accepted the invitation.
Well, thank you for having me here.
Absolutely. So, did you want to share just a little bit about yourself?
Yes, I am a doula. I am certified through Donor International. I've been doing this for over 10 years. I try not to tell exactly how old, but the oldest baby I supported turned 26 in December.
Wow.
And I
Wow.
got to see him. He is a coach in Texas. It's like
Nice.
super exciting.
Isn't that nice?
But yes, I really love what I do. I love supporting mothers. I feel like so first of all, I'm a widow. My husband passed away 4 years ago, and I was also his caretaker. So I learned the hospital and how to speak to doctors and understand how they kind of push us black and brown people into things that we don't typically want to do. And so I came back home after he passed away. We lived in Colorado for a few years, and I came back home after he passed away, and went into the supporting people in the homeless shelter. And the women were having babies and asking for help again, and just not able to find or be able to afford doulas. So I gave myself time, and I was like, I'm gonna go full time as a doula in like a couple years, and I just did that. So
Wow. Exciting.
yeah,
Definitely
Yeah,
exciting.
yeah,
that is. And when Tanya mentioned that you'll be joining the show today, I was excited too, because as Tanya mentioned, like maternal health is definitely an area we've been wanting to really explore through our organization. And then the whole topic of doulas, like that's just an area that a lot of people are unfamiliar with. I think I became more familiar with like what a doula does through I have a very good friend that I met in college, and so she's a certified doula,
awesome.
maternal health advocate. So just watching her journey, that's how I really got to understand what it takes and what's involved. But I'm definitely interested in learning more today
Yeah.
through this episode because I feel like a lot of people out here. I'm like, how do you access a doula? Like what are the benefits versus, a midwife? Is it the same? So there's so many questions, and I know we're gonna go through all of those today.
Hmm.
So Tanya, did you want to talk about, I guess, lay the foundation for maternal health and what Black women face in the U.S.?
So I thought we could have a conversation around the most current stat, in which it says that Black women in the U.S. are 3 to 4 times more likely to die from pregnancy-related causes than white women. So
That is correct. Because depending on where we're from, our communities, not being educated enough about birth, we fall into high blood pressure complications, diabetes, asthma, preeclampsia, postpartum hemorrhaging. I had a client that when I took her on, she told me, like, as we were going through her history of her previous birth, she was like, after I had my last baby, I bled every day
Mm,
for 9 months.
Mm.
And I was like, what? And she said, I called the doctor. Nobody was listening to me. And on the ninth month, this is after having her baby, not pregnant, but after having her baby, she was sick, couldn't go back to work, etc. After calling her doctor and saying she was going to the ER because the bleeding had not stopped and she was worried, they had to do a DNC. She was in the middle of a postpartum hemorrhage for 9 months.
Wow.
wow.
Nobody took her serious. So when we went in to deliver her baby, this was the second baby, I made it my commitment to her that I would sit with her. And I typically do sit with people after their births, but she did. She was telling the doctor, I think I'm hemorrhaging. And the doctor, they were there, but they were like, "No, we don't really see any blood. We will see it before, or we will feel it before they see it." And I was like, "No, she's not good," because she had told the doctor, "Take my baby and put it in a warmer." And that's a flag for me because most women, when we have our babies, we want them on us. Give me my
Mhm.
baby, put him on me. What's wrong with my baby? And she was like, put the baby in a warmer. And I was like, So I stood up beside her because usually I'm like walking around, I'm looking to make sure they're sewing you up right and they've gotten your placenta out and there's no blood clot. So I'm watching. And I was like, no, and I looked at the nurse. I was like, no, this is serious. And at first, everybody was hesitant. I was like, hey, she looks like she's going to pass out. And it shouldn't take that much. If I'm supporting Caucasian women, they can say I have the hiccups and people are on top of it. Oh, we already gave you more fluids, more medicine. You don't have to. But black women, they are slow to move. It's almost like because our complaints are fake or something. So that is right why we fall to those stats and those statistics.
Mhm.
Mhm.
Yeah. And I think we touched on this a little bit in season one when I can't remember which episode because we were saying as black women, it doesn't matter how much money you make, how many degrees you have, how famous you are, if you're not famous. Like we all have those same experiences
Mm-hmm.
when it comes to pregnancy, dealing with the healthcare system, them not listening to us when we're expressing a concern. So the fact that you experience that in your work
Mm-hmm.
just basically validates like everything that goes on. So thank you for sharing that.
I know.
Yeah, I appreciate you sharing that story because I always try to think back to my experience with having my son. And I was fortunate, like, I didn't have any complications, I didn't have any issues. And I feel like the care that I received was pretty decent. But I know there are a lot others that are pretty unfortunate and have similar experiences. So, yeah, always interesting to hear that.
Yeah.
Hmm.
Yeah.
So, I figured we'd start off by just talking. I know you shared a little bit about your story, like what made you interested in becoming a doula. Um, I guess for people that are just unfamiliar
Mm-hmm.
with the term, like what doulas do,
Mm-hmm.
can you share about that a little bit?
So, what doulas? Well, first, let me just say that doulas are non-medical professionals, and we give evidence-based information and support to mothers. So, for example, one thing that I will do. Is we offer prenatals, right? So in those prenatals, we start up in my practice is that I start up with finding out what happened before if you have had another baby. If this is your first baby, what have you heard? What did your mother tell you? What have your family experiences have been. Because one thing is, you're going to have that mother or that aunt or that sister or that cousin that's going to be like, it was horrible or this happened to me. And so I want to know what your fears are so that we can talk about that. So we provide prenatal conversations. We talk about all of your fears. We talk about what to expect realistically because birth is not one size fits all. So what you experience, the next woman may not. So we talk about the things that's going on because a lot of times women will hire us at 34 weeks. I like them as early as they are willing to come to me. I don't care if you just found out, I will support you. And we talk about like preeclampsia. I educate you on how the hospital goes. I encourage you to go to the hospitals and do walkthroughs and get a vibe for the team because the hospital can be as high tech as possible, but that bedside manner you're going to remember.
Mhm.
And the only reason why we're really worried about high tech hospitals is your baby going to end up in a NICU? That's where we really care. Or at least when we're
Mhm.
having our conversations. And then as far as looking at that support, you have a doula that can be with you for, you know, or can answer phone calls for you 24 hours. Um, and so where you're, am I having Braxton Hicks? And you don't want to call your doctor at midnight and be like, am I having Braxton Hicks? But it's a real thing. Like, I'm really worried. Am I
Mhm.
going through this? So, having a doula is somebody, a companion that can be there for you and give you not just physical support, but emotional support. I had a mom that was so frustrated that we were like 40 weeks in. She would call me at 2 o'clock in the morning and just scream, ah! And she'd be like, okay, Court, I'm good, and hang up. And that was her moment to just get it out because emotionally, mental health is important
Yeah.
during pregnancy.
Mhm.
So that those are like things that you can use your doula for. And then for birth, I am there to support you as far as making sure that one, again, back to those fears, because just because we talked about them, but when you get into birth, those fears come up again. And then I also support you as far as like physical, giving you massages, putting you in positions to help your baby drop down, watching your baby's heart rate, watching your blood pressure. I'm just kind of like your caretaker. If you are second guessing your care, you can look over to me and be like, should I? Would I? Now, I don't give you the advice of, no, girl, you're going to do this. I go, how do you want to go?
Mhm.
So if they're offering you Pitocin, I'm going to say, how fast do you want to go? Because that's where we're going to use Pitocin. But if we want to go slow and we want to make sure our bodies is accepting this medicine, I'm going to say, let's start with the Foley because that's non-medicated, but it will open your cervix and we can see how your baby tolerates it if you're doing an induction. So we talk about all of those things that's going on. So that education. And then as the baby comes out, again, like I said, I'm there for kind of like immediate postpartum care, making sure that if you needed stitches, that you have stitches. Daddy was able to either catch the baby if he wanted to be the first one to touch his child. He cuts the umbilical cord. I'm there for all of that support. I also do pictures. So if there's nothing going on that's like immediate care or that I'm helping you, you know, then I can do your pictures. I'm making sure that you guys are good. I make sure you've ordered your I say push meal, but I make sure that you order your meal because one thing about it is we're as women, we're so nurturing and loving and we care about feeding this baby. We forgot to feed ourselves.
Right.
Mhm.
So I try to be all of those things as a doula. And then I also offer postpartum care. So where there's different versions of it where if you're on Medicaid, it's virtual. But private pay, they can ask for other things. Like I do meal prep, sibling adjustment, things like that to help babies or help families get back to one whole unit instead of mom's just I just gotta breastfeed. I just want to take a nap. I just want to breastfeed. I just want to take a nap. We're trying to make sure moms eat and they actually get the sleep and care that they need so that they can come back and be the mothers of the family and the caretakers that we are.
Mhm.
Okay.
That's a lot.
It's
It
a
is.
lot.
I
I'm
I'm
was
about to
like,
say
sorry.
that is.
as I'm just listening, I'm like, wow, because
It's a lot.
you always think about the support that doulas provide, like during birth, but you
Hmm.
don't think about the before and the after. So that's a whole lot.
It's a lot. I've been at births where they have been 5 days.
Mhm.
I've been at births where they've been a couple hours. So, I show up with my whole little wheel and my bag and my chair, and I make a spot for myself. But I'm all about serving my mothers. I always tell them in our meetings, you are my queen for that day, and I'm going to take care of you and honor you like that
Mhm.
because you're going through it, building this whole life and making this baby come through. And for moms that are in inductions that take 5 days or 3 days, it's a lot. Like,
Yeah.
Mm-hmm.
especially if
It
you
is a lot.
don't eat the whole
Yeah.
time and, mentally you're in these four walls, you're not seeing anything. It can be a lot. Even when I'm at people's water births at home, it can be a lot emotionally.
Mhm.
So.
And because you do so much, like what type of trainings or certifications are required for you to be like a certified doula?
So for a certified doula, I went through Dona International. I chose Dona International because it's like one of the like big companies that they do a lot, and also they were the company that put the word doula in the dictionary.
Oh,
The word doula was used around the 1960s by Dana Raphael, I think. And so this company was big on just kind of supporting doulas over the years. So I went through them because I really wanted to know what are the women learning? Because while I'm supporting people, what else is out there that we can do, especially with all the things that are happening to Black and Brown women?
mhm,
What are you saying? And how are you taking care of your women? I want to be on one accord, or I want to know as much as I can.
right,
So I went through Dona, but in Maryland, we have plenty of other companies that will do trainings. They do in person trainings, they do virtual trainings. My certification, I have a full spectrum doula certification through Dona. And then I also went back and did Dancing for Birth. So I have that certification as well.
mhm,
I do carry a CPR because I do sleep train with families.
mhm,
So I'm with your baby overnight. And I have stayed with babies that were high risk babies that had different um, mental or physical things going on that I needed to take care of them. So I do carry those myself personally. But some women do spinning babies, they do hypnobirthing that helps you with pain and just kind of keeping your mind steady.
mhm.
So you can find a doula that covers a lot of different things for you.
Okay.
Okay.
So like as far as like timeline, like I know you mentioned like the additional, I guess, trainings, but I guess for just is it the full spectrum? Is that
Mhm.
like the baseline training everyone has to take?
No. So, okay, so let's break it down. Initially, a lot of people became doulas or were doulas. It was more or less like another doula trained you and
Okay.
taught you what they knew, and you said, "I'm a doula." Understand? And so you could support like that. And those are really amazing
Mhm.
doulas, right? Now, where you wanted a certified doula was that the state wanted to have us um, be able to support Medicaid. And they wanted us
Mhm.
to all be on one accord. So that's kind of how you have to look at it. So it depends on how you, like, I don't want to negate the doulas that don't have a certification
Okay.
because they are just as good.
Okay.
It's just that if you want to use a doula for insurance, she
Mhm.
has to be certified. That's something that the government wants.
Got it.
Okay.
Okay.
Does that make sense?
Yeah,
It
yeah, it
does.
Okay.
does. Yeah, it does.
So, yeah.
Because, I guess in my mind, you think of certified doula, you sign up for like a program, and it's like you have to get like 100 hours of this type of
Yes.
training, and I always looked at it that way, but I didn't think about the doulas who aren't certified but still are just as qualified
They
as
are.
those who are.
Mhm.
They are so amazing. I mean, I talk to all kinds. I talk to doulas that are certified, the ones that aren't. I mean, a lot of us started not certified. And then for me, it was more or less like, how can I help? I had this one lady, and she was like, I only have Medicaid, and I heard that you were really good. Please, please, please take Medicaid. She was my push to take Medicaid.
Okay.
I had already went through my donor classes, but I did not submit the certifications because I just did it for my own learning.
Mm,
It's just I wanted to be able to be more knowledgeable for the people that I was taking care of. So she was like, "No, Court, I really need you."
okay.
And this lady, like, she waited for me to get, like, I had everything done. I just really need to just mail everything in. And so she waited for me to mail it in. She waited the 30 days for them to send the certificate, and then she came aboard as one of my mothers.
Hmm.
So she was the real push for me to just go get certified for Medicaid. But as far as a lot of us just took trainings just because we wanted to know what everybody else was doing. So
Okay.
I don't want to say that. But as far as like, you can find trainings that go as long as 6 months. You can find trainings that go, so the training is like a weekend, but you have to go out and find your mothers and practice with your own
Hmm.
people on your own and figure it out, kind of get it out the mud type of
Hmm.
deal. And then you go to the next part and you do that training and you get it out the mud with the next
Hmm.
mothers for free.
Okay.
So it just depends on the training that you want and what you're trying to learn.
Okay.
There's some that train more cultural, um, black culture. We do kind of like bonding your body, or
Mm.
binding your body is what I'm trying to say, so that we close your bones after birth. So there are companies that train like that, and then there are companies that are just kind of like so Donor International didn't train us with closing the bones. So I learned that through Dancing for Birth.
Okay.
So there are different places that you can get all kinds of things from.
Okay.
Mhm.
That's helpful. Thank you.
I am learning so much
I was like,
right now here. Okay.
what?
But for those that may be still a little confused, like
Mhm.
the difference between a midwife and a doula, like if you were just to say, like briefly, what's the difference?
Okay, so a midwife is a clinical profession. She's going to do office visits with you, or she might come to your house and do the visits. She's going to order exams and blood tests and things like that. And while some midwives are 24/7, during birth, she can cover multiple women at the same time. Whereas doulas, we are non medical professions. We will support multiple women, like as far as like our prenatals and things like that. But when it comes time to birth, we support that one person during birth. We also do not order like blood results. We don't go over any of those things. While we might understand what's going on with you, we don't give medical advice.
Okay.
We are support people. We support you emotionally and physically.
Okay.
Okay.
Got it. Got it. Got it.
Yeah. So I guess shifting back to the advocacy piece and navigating the healthcare system, what role will you say that doulas play in addressing the disparities and systemic racism that impact Black maternal health outcomes? And I know you gave an example earlier
Mm-hmm.
of the situation with the hemorrhaging and how
Mm-hmm.
you were an advocate. Are there any other examples or anything else? Well, I'm sure you've done a lot more, but
Yes.
anything else you want to
Yeah.
share, I should say.
So what I will say is the biggest thing that we do to address those disparities is the education.
Hmm.
Mhm.
So often mothers pick doctors. And we think that when we go into the doctor's office, that doctor is going to explain everything to us.
Hmm.
For example, being GBS positive, a lot of people are like, oh my God, I have a sexually transmitted disease. And that's not necessarily what it is. And so we have to educate what it is, how it affects you, what you're going to see happening through birth, right? And so being able to be that person to educate you, explain, and put your fears at ease. Like, I had a whole mother who was just like, I'm scared to tell my husband I got this disease because I don't know where I got it from.
Mm.
And it's strep B. And it's not something that she got. It's laying dormant in her. It may present itself with one baby, but not the next baby. And so with that, education is important to
Mm-hmm.
address it. The other thing that we run into is that I love me a black doctor, but I ain't gonna lie. I've run into black doctors that aren't very supportive of black women.
Mm.
And so while one of my mothers was very excited about this black doctor that she got and her whole birth team, because now she's got her doula and her doctor and everything's supposed to be great, her doctor was like, I'm not answering questions during your visit.
So what are you doing then?
Mm.
So as a doula, I was like, well, listen, what we can do is we can find you a doctor that will answer a question
Mm-hmm.
and make you feel good because this is your body and it's your choice.
Mm-hmm.
Um, and so that's how I kind of help is by giving you resources, making sure you know, like if if your mother said this is a great doctor and you went to that doctor and they treated you like that, you would second guess it. You would be like, but I mean, like, they're supposed to be the best doctor. Is it me? Am I upset? Am I having pregnancy hormones? So those are the conversations that we have. And so it allows you as black women and brown women to feel confident to be like, this isn't for me.
Right.
Mm-hmm.
Because we are so sweet.
Mm-hmm.
Like, I'm telling you, people think that black women are just so snippy, but we are so sweet when we get into the hospital. Sorry. Oh, I didn't mean to do that. What? If you don't tell them people you're not getting in that bed,
Right.
why are you getting in the bed at 4 o'clock in the
Mm-hmm.
afternoon? Don't get in that bed.
Mm-hmm.
Stand up and exercise and help your baby.
Mm-hmm.
What are you talking about? My Caucasian women walk in and they're like, I plan on eating. I have a caterer coming. I have this going on. And my black women are like, sorry, I ate. I didn't mean to throw up. We know throwing up might happen.
Mm.
You know, so like it's so many things that we do that people seem to have an attitude with us, but then
Right.
I see it. I take all kinds of people. I love on everybody just the same,
Mm-hmm.
but I get so annoyed because the moment that black women have the right to be, I guess, a bridezilla, we're just like, okay, we'll just lay in this bed and shove and take it. Yeah,
Mm-hmm.
you could just do whatever. Like yesterday, I was at a birth and the doctor, me and the mother, we had a conversation about what would be acceptable.
Mm-hmm.
When do you want to stop having cervical checks? Because you don't have to have them, right? The baby's going to come when it's ready to come. Now, unless something is really happening that we might need to be checked, then let's do it, right? The doctor comes in and they're like, okay, we're going to check you. Because their line of work is we need to check you every 2 hours. That's what the policy says. But they're going to tell you that's not what the policy says. We just need to do it, right? But you'll notice they come every 2 hours, no matter what, right?
Mm-hmm.
So she's like, no, I'm good. I want to sleep. They came back in 15 minutes and was like, okay, so we're going to check you. She's like, yeah, I'm asleep. I'm not going to do it. So 15 minutes later, another doctor comes in and they're like, so your baby's heart rate dipped. We're going to go ahead and check you. How you going to just tell somebody we're going to go ahead and check you? So she was like, and this was a part of the education, right?
Mm-hmm.
She says, oh, well, what did the heart rate dip to? Right? And they said, well, it really didn't dip like
I
that,
knew you were gonna say that.
right? But what we're seeing is the baby is not, maybe it's not getting enough oxygen. She said, well, how do you know? Because, see, we've already had these conversations
Mm-hmm.
in prenatal, right?
Yeah.
So she's like, well, how do you know? And I'm there for that extra support, that extra. So the doctor's like, well, okay, we'll be back in 15 minutes. Would you let us check them? Next doctor walks in, and this one was a black doctor. And she says, so she puts her gloves on. Your baby really probably needs our help. And I think that it's time that I need to check you. And she said, Kortny, I think I'm gonna go ahead and do it. And I really don't want them touching me. So what I said to her was like, if you don't want to be touched, your body is your choice.
Mm-hmm.
I mean, and she said, yeah, it's my body. I don't want to be touched. So the lady takes her gloves off, puts them in the trash. She leaves out. and I'm watching the her heart rate, her blood pressure, everything, and the doctor. I see the baby's heart rate kind of it didn't really dip, but I knew they were going to use that to come back in. So I sat her up and I said, "Look, they're going to come back in here in like 10 minutes." And I did see something that they're going to probably use. I'm not worried, but I want you to be alert enough that because this is going to be the conversation. This is going to be it. Whatever you want to do, we're going to support you. She looks at me. She goes, Coco, it's time to push. And I said, what? She said, it's time to push. So throughout the day, my goal is to get your baby as low as possible.
Mm-hmm.
This is a first time mom who probably doesn't know or would second guess that it's time to push. And so I was like, I'm getting the baby as low as possible so that we don't push forever, right?
Mm-hmm.
So I put her in all the positions. We got baby low. We knew baby was low. She looked at me. She goes, "It's time to push." I was like, "Okay." As soon as I got her situated in the bed, they walked in and they were like, "We want to talk to you." She said, "It's time to push." I counted her down 30 seconds. Baby head almost pops out. They're like, "Stop. You gotta stop. We gotta get the table together, right?" And so get the table together, come back. I counted down another 30 seconds. Head, shoulders is out.
Wow.
We had a Caucasian nurse, loved her to death. She's like, "This is black girl magic." She's like, "This is what I'm talking about." She believed her body. She was like, "You're the best doula." She was just screaming. She was like, and then so baby was born at 7 o'clock. So she's like, 7 o'clock on the dot. And I'm like, oh my God.
That's
We
funny.
were having a ball. But
Right.
that's when it was a butter birth. There was nothing wrong. And they tried to scare her into this. And that's where you get into, you could be pushing for 3 hours
Mm-hmm.
because they're pushing you to try to push early, right?
Mm-hmm.
And because she was educated to know that she didn't have to. And I've had a mother that took it. I don't change your mind. I just educate you, right? She took it. She pushed for 3 to 4 hours and they were like, "Oh, you just can't get the baby out. Time for a C-section."
Oh.
That's how we end up in those type of predicaments.
Mm-hmm.
Yeah.
And that's why I like to make sure you're educated and you can make a decision that's best for yourself.
Yeah.
Right.
I love that story.
Me
I
too.
can hear stories like that all day.
All day. I
All
have
day.
them all day.
All day.
I had a baby yesterday. I had a baby the day before. I was like, oh my goodness. And I wasn't even expecting them this week. So
Mm-hmm.
but they were good stories.
That's good.
Wow. Wow.
Yeah.
So, have you had any challenges in your role since you're saying that you're not like a medical professional? Have you had any pushback from any doctors or any hospitals?
Yes, there is a hospital that if somebody tells me they're going to it, I do not want my mothers to go to it. There's a couple. There's one here in Baltimore. I really don't want them to go to. Um, I won't say it because I don't want to,
Right. Yeah.
but I really don't want them to go to. They are a learning hospital. And so sometimes they do things on purpose to learn. So, for example, we were doing warm compress in between pushing. And it's something that I really support. And I will tell them and I will remind you, do you want to do that? And she said yes. And we were doing the warm compress. And as a doula, a medical staff person has to tell me it's okay for me to hold it because I can't be down there. So initially, I was able to hold the compress in between pushes. And the doctor that was teaching came in and said, no, this person has to hold it.
Mm-hmm.
So that person took over and started holding it. And I saw him say, stop with the warm compress. And I said, do you still want the compress? And she said, well, we'll see what they're doing. That's all I have to do. But oh man, did it frustrate me because she split. And so the lady I was telling you about yesterday, first time mom, pushed a 7-pound baby out. We had no tears.
Mm-hmm.
Warm compress in between. Everybody in the room said this was the fastest pushing that they've ever had because we counted her around 30. We waited. We counted her around 30. Baby was out, right? This mom split from top to bottom and her muscles.
Wow.
Mm.
But that's because we're learning how to stitch her back together. That's not fair. I don't think that that's fair. And that's not what we signed up for at a teaching hospital. The other hospital is in Montgomery County. If I have the opportunity to talk somebody out of this hospital, I do. I will recommend others. I will recommend different doctors, backups, everything. Because when it comes to black and brown women, they are so biased. It's very racist.
Mm-hmm.
Even down to the black nurses that support there mistreat our black women. And I think it's because it's a habit. So for instance, this one week I was there with the Caucasian women. Things were great. They brought her food. We were up and in and out the bed. We were moving around. My black mother, 3 days later, same nurse, same doctor combo. First of all, we go with the Caucasian people and they're like, oh, you can have your parking validated. My black people, I said, do you guys know that? Did they tell you you could get parking validated? So the nurse is like, oh, yeah.
Oh yeah. What you mean? Oh yeah.
Right. It's us, girl. Hook us
Yeah.
up, right? He
Yeah.
was like, what? I don't get it. So then I was like, okay, well, are you hungry? Well, the doctor's not going to let them eat. I said, well, what does she have going on that doesn't allow her to eat? Because I was with you last week. I know you probably don't remember me, but I remember you. And she goes, huh? And I said, you offered food to my last couple. What happened in her? Why can't she have food? Well, thank God we had a birthing plan that was signed by her doctor. And because of those doctor notes, because that's what it is, because it's signed,
Mm-hmm.
uh, we were able to get food.
Mm-hmm.
But it had to be a pushback. Same hospital, months before this, black mom, we go in. It's supposed to be a great birth. As soon as she gets in, they say, oh, you're having a C-section. She said, no, I'm not. I didn't come here for a C-section. The whole night they chastised her. They came in, they told her she was getting a C-section. There was a sign that because of her religion, men weren't supposed to touch her unless medically necessary. So that meant that the nurses had to check her. He said, oh, I'm checking you. And it just became very like combative, and we were back and forth. You want to relax through birth.
Mm-hmm.
We're in there. She's having contractions. She's rolling back and forth off the bed, legs wide open. And he comes in and he's like, you're not having contractions, are you? You don't feel them, do you? You can't see this lady's having contractions. What are you talking about? He started cussing me out. He was like, it's you. You're the problem. I haven't said anything to this man. He's like, you're the problem. I'm going to have security come take you out of here. I'm going to do this. I'm going to do that. Need I say, he was a Caucasian man. I'm 5'3". He's probably 6 and some change. Big guy. I'm sitting in a chair lower than this. He's standing over me, cussing, dropping F bombs. Like, F for what? Because she won't let you check her. And her nurse, a Caucasian woman, oh, she was Angel.
Mm-hmm.
She was like, stick to what your doula's saying. She's right. You don't need to be checked. So she looked at the nurse. She said, if you want to check me, you can. The nurse said, I agree with your doula. You don't need to be checked. That lady walked out of the room. She came back in. She told us, after I finish with you guys, I've already put in my resignation at this hospital.
Wow.
Wow.
She said, I typically work in Virginia. I won't be back. This was the most horrible situation I've ever been in. The mother chose not to do vitamin K on her baby. As they're passing her the baby, they're like, we want to do vitamin K. She said, no. He said, but we're going to do vitamin K. She said, no. And I mean, she just got her baby in her arms. She asked for another doctor. They wouldn't give her another one. Like, imagine pushing into somebody that has been cussing at us the whole time. It
Right.
was a horrible situation, but I was able to keep her calm. We stayed on the mark. I mean, when I left that birth, the way my shoulders were tight, it was like I needed the armor of God, and I take
Mm-hmm.
it with me every time I go to that hospital. Like, even if I can't talk you out of going, I'm going prayed up, because man. But yeah, those are some of the
Yeah.
issues.
Wow, that's challenging.
Look, after we finish this recording, I'm gonna need to know the name
Yeah.
of them hospitals. You ain't gotta
Yeah,
say it
I
on
get
tape,
to you.
but that is crazy.
Yes, no.
Um. Okay, so I guess just to transition to sexual health, and I'm gonna try to
Mhm.
combine these two questions.
Mhm.
So, how do you support your mothers
Mhm.
in understanding and navigating sexual health, especially HIV prevention and care? And then also, how do you at the same time, how do you help with reducing stigma associated with HIV?
So I know I've said this like almost like at every question. Is a big part of education. So in our prenatals, we talk about sexual health if needed.
Mhm.
Because again, everybody does not need the same care. So it is based on making you feel comfortable enough to tell me about your sexual health. And so we talk about some things, but even with like I said, with that mother that had GBS and she thought it was very uncomfortable for her to even bring it up. So, getting my families to feel comfortable, to trust me, and then we educate about those types of things, how to stay safe during pregnancy, going in and staying up on your appointments, making sure that you're getting your tests done. Those are important. And then if you have any sexual diseases or anything going on with your sexual health, how to get the resources to help you and how it's going to affect your life
Mhm.
and relationships. So we talk about all of those things and just kind of encouraging them to have, better relationships with their doctors. And again, if they don't have a good relationship and they're not getting the right information, how to change or look for another doctor.
Mhm.
Mhm.
And that's the important part. You're not stuck with that
You're not
person.
stuck.
You're
Absolutely.
not
I
stuck.
tell people we build these teams, and the biggest thing I say to people is just because you have Medicaid or any kind of health insurance, look at it like that's your MasterCard. Because if you're gonna pay for something if you go into, I don't know, a Chanel store and they give you the wrong bag, you're gonna be like, it's the wrong bag. That's not the bag I want. You're not going to pay for it.
Mhm.
But for some reason, because we have Medicaid, we're like, oh, yeah. No, that's still a credit card. Look at it as a credit card. You're buying your doctor's services, the hospital services, my services. You're not stuck with us.
Right. Right.
That's something. So, in our last few minutes, I heard you say that doula services is covered by Medicare. I'm sorry, by Medicaid. I'm not sure if it's covered by other insurances, um, but how do people access doula services?
Okay, so it is covered by Medicaid. Not all insurances cover doulas. Some ways you can use your insurance for a doula. Some companies will do reimbursement in your HSA account.
Okay.
Oh, okay.
There are companies that do grants for doulas. So, like if you don't have all the money to be a private pay client, they will give you some of that money.
Mm.
And then finding a doula is so for me, you could go to dona.org or doulacoco.com. But for other doulas, you can kind of look for us on different platforms, like going to if you have Medicaid, go to your member services and speak with them, and they will recommend the doulas in your area.
Mhm.
Um, See, the other ways is there's a company called meetmay.com and they do support women. I support on their platform as well. And so they have like a host of doulas in this area that you can use or you can even go through. But one thing I would always tell people is like interview your doula,
Mhm.
make sure that we're fit for your team because some people need that grandma doula that's like, get over there and get on that bed and do this. I'm not that person. I'll be like, look, here's 5 things we can do. Does this feel good to you? How does that feel to you? Which one do you want to use right now? Okay, so this is my suggestion. We're going to do 1, 2, and 3. Are you okay with that? You don't feel good with that? Okay, we can do this. I'm not the grandma doula. I'm
Mhm.
going to give you plenty of options and we're going to work with the options that you can do. And if you say that you can't bend, squat, walk, then we're going to find something else to do.
Mm. That's helpful.
That is
Mm-hmm.
helpful.
That's
Yeah.
helpful. And I guess, and I'll let you close out, but just real quickly, if anyone wanted to get in touch with you specifically, is there a way folks could reach you? Mothers could
Yes,
reach you?
I am Doula Coco 42 on Instagram, and then I am doulacoco.com. And yeah, that's the best way to get me.
Okay.
Yep.
Okay.
Okay. So that was an amazing conversation.
Oh, yes,
I've
it was.
learned so much. I mean, seriously, to go from the place or the space of not even being able to identify a doula to now to really kind of understand like the different types of services that you offer and just all of the experiences that you've had with the healthcare
Yeah.
systems. Yeah, it's something I've really, really learned something, and I believe Ashley,
Yeah,
you
same,
could say the same.
same. Yeah.
Yeah. So we thank you so much
Thank you for having me.
for accepting the invitation.
Thank
Yeah,
you
and
so
being
much.
here on our podcast.
We look forward to seeing everybody again for the next episode. So thank you again.
Thank you.
Thank
All
you.
right.